All right, looks like people are getting connected up. Hello and welcome to the next in the Delphian series of webinars. Today we're going to be covering basic first aid and emergencies. This is going to be a three-part webinar series that we do. We're doing one today, one tomorrow, one on Friday. And in those three, we're going to be going through the Heron Books course of basic first aid and emergencies. My name is James. This is Remy.
Hello.
And we've both been at Delphian for several years, and we're really looking forward to going through this course with you guys. I see many familiar names on here. It looks like a lot of people have been attending many of our webinars. Thank you very much. This is the first one I've been delivering. So thank you for being patient and bearing with me as I get used to the setup here. Hello, Gayatri, and hello, Brittany. I see that you two are familiar with the question and answer box. Thank you. The question and answer box is what we're going to be using for our interaction with you guys. There's a thing to raise your hand. There's a chat box. We're not going to be using those today. Go ahead. Any questions that you have, throw them into the Q&A box. Okay.
I remember you too, Milo.
All right. Excellent. So we're going to jump into this. The first thing we're going to do is some reading. Here we go. We're going to read the section called First Aid. Aid is help. First aid is emergency medical help, the help that is given first when a person is sick or injured before they can get full medical help. It can be very important to know first aid so you can help an ill or injured person who cannot get to a doctor right away. For example, if you know how to help someone who is choking, you could possibly save his life. He might still need to see a doctor to fully recover, but you would have handled the emergency. Other common examples of things that can happen when a person needs first aid are knife cuts, sprained ankles, insect bites, car accidents, or when a person gets too hot or too cold. Knowing some simple things about giving first aid can help you help people when they are hurt or very uncomfortable. I definitely agree with that. Remy, have you ever had a cut?
I've had many.
I have too, and it's nice to know how to clean that cut and to bandage it up so that it doesn't get infected.
I completely agree.
Yes. Now, for those of you following along on the learning guide, the next part here is an essay on what does it mean to give first aid, what is first aid, and what are some examples of giving it. We're not going to do that here. Feel free to do that. All of you attending here would have gotten a welcome email after you registered for this webinar. Please do download this course pack and this learning guide, and you can follow along at home or you can do it separately after this webinar as well. I highly recommend it. Okay, we're going to get into covering the next bit here, minor wounds and bleeding. Minor means not very major, smaller, not huge. A wound is an injury in which some part of the body is cut or hurt in some way. A minor wound is one that does not cause a lot of bleeding or damage, but still needs to be handled. Examples might be a skinned knee or a cut finger. As Remy explained, he has cut his finger, and I think we've all experienced skinned knees. Minor wounds usually stop bleeding by themselves and just need to be washed, then covered in a sterile bandage, like a Band-Aid bandage. Sterile means it's clean. Sterile means there's not germs on it. We all know Band-Aids. Band-Aids come in these packs, and when they're made at the factory, you know that they're totally clean. So if I open this up right now, only now is it being exposed to the air, to things that might be in there, to germs, to bacteria. That's good. So I know that when I put this on my cut finger or something like that, that it's clean. I don't need to worry about, is this dirty? If I opened this up and then I dropped it, like, on the ground, I probably wouldn't want to put that. I would grab a new Band-Aid. I'm going to want a clean, sterile Band-Aid.
What if I had a tissue or a napkin that I used earlier in the day and still had in my pocket? Would that be a sterile bandage?
That is not a sterile bandage. That is going to have whatever else was in your pocket is now on that bandage, at least a little bit, or now on that tissue or handkerchief. You definitely would not want to blow your nose and then use that tissue to, cover a cut.
Good to know.
Okay. So covered with a sterile bandage, like a Band-Aid bandage. A sterile bandage, there we go. A sterile bandage is specifically made to be germ-free. Small ones usually have sticky parts to hold the soft material over the wound. I don't know who invented Band-Aids, the sticky bandage, but I would love to give a huge thank you to them, whoever they were. If you can, it is good to use antibiotic ointment also. The word antibiotic comes from anti, which means against, and biotic, which means living things. So against living things, specifically small living things like germs, not against big living things. Antibiotic ointment is a cream that you put on a wound that helps kill the small living things, germs that might get into the wound. You put it on the wound and then put the bandage over it. If germs do get into a wound and start attacking that part of the person's body, this is called an infection. Germs are around us all the time, but our bodies usually stay healthy, showing that the body can usually fight off and kill enough germs to keep them from causing a problem. But sometimes the germs in a wound win for a while, and a wound gets infected. So an important part of first aid is getting a wound very clean, so this doesn't happen in the first place. If a wound does get infected, the general rule is to get some medical attention. Here's how to spot a wound that is getting infected. At first, the skin around the wound gets a bit red, puffy, and even sorer. Pus may form. This is a yellowish, thick liquid that oozes from a wound or is trapped inside a wound. If the infection gets worse, the skin around it gets much redder and swollen and quite painful. An infection can make a person feel ill, even possibly giving him a fever. An infection that has been left alone too long can even spread through the blood, and red streaks can be seen on the body going out from the wound. If you use good first aid, as discussed below, we're going to go over some situations below. Most minor wounds will heal just fine, but you should be alert for signs of infection, and if you see them, get medical help. All this stuff that your body's doing, the body is an incredible thing. It is constantly fighting off millions of bacteria and germs and viruses all the time, and you don't even know it. It's amazing. So when it does actually need to put even a little bit of effort into it beyond the normal, that's when you notice it. That's when you know, the cut on your finger starts to get a little red and swollen. Your body is sending more stuff to the site of that wound to fight the infection and to fight the stuff. If you're one function of bleeding, you don't want stuff inside the wound, you want it out. The good thing is that when you bleed, the blood goes out, and if there was let's say a speck of dirt that was in that cut and you bleed, and the blood can carry that dirt out of the wound.
So why is it so important though to keep it clean? Like what happens if you're trying to heal and it keeps getting dirty every day?
Well, if it keeps getting dirty every day, then you're adding new stuff in there. The cut is one problem. The infection, germs getting inside, that's the second problem. And I'm glad that we know about this. And it's not just, why does my finger hurt way more now, even though I only cut it a little bit last week?
Right.
Well, you were also, playing in the dirt for the last week, playing in mud and getting stuff inside the wound.
Right.
When you do get that pus in there, that yellowish, thick liquid, that is your body attacking that infection. It's attacking the germ. That's a natural response from the body. And it doesn't look pretty, it doesn't smell good, but it's your body doing this amazing job of jumping in there and attacking it. Okay, we have some pictures of some infections. They are, let's see where to go. Here we go. All right, so you'll see there's a cut on the person's finger, and you can see that it's kind of red around that spot. That is a sign that your body is working to fight an infection. Now, the picture that I'm showing there, it shows kind of a fresh cut, but you see that red area around it. If you start to see that on your finger or around any other cut that you or someone else might have, that's an indication it's starting to get infected. Here we go, we're gonna move along again. Again, on the left side of the screen, you can see that cut scene. That doesn't look great, does it, Remy?
No, it doesn't.
And the cut on the person's hand on the right side of the screen, that's even worse. You're starting to get a lot of color happening there, a lot of reddishness. That's definitely, if you had a cut that looked like that, you definitely want to go see a doctor or a nurse to get that looked at. Let's see. Okay, well, that's the end of the slides I had for that little section.
Looks like we got some questions. Should we check out?
All right, let's pop in here. People saying hi. Hi. Welcome. Okay. Hello, hello, hello. Okay, we had a question for a few minutes ago. What subject is this? I think we've covered that, but this is basic first aid. Some basic things that could happen to make people ill or injured and what you can do to help them with that. I was once told to use hydrogen peroxide instead of cleaning alcohol. Does that work? Hydrogen peroxide is a great substance for cleaning out infections.
Absolutely.
I didn't bring any of that with us here today, but that is a great solution for killing germs. I many times have used that on myself. I'll have a cut on my hand and I'll pour it on. What you'll notice with hydrogen peroxide is it starts to bubble.
Mm-hmm.
It looks kind of weird. It feels kind of weird too, and it kind of stings. That's okay. That is it working to attack the germs. And yeah, it's good stuff. All right, what if my guinea pig ate a piece of lettuce that fell on the floor? Would she get sick?
That's a great question.
It's a really good question. I would say probably not.
Most likely not.
Most likely not.
The body, and even your guinea pig's body, she's got a great chance of being able to fight off whatever bacteria or germs are on that lettuce. Now, it's not to say every time that they would, and sometimes you might get sick from something that had been on the floor. And I definitely would not recommend eating it yourself or feeding your guinea pig things that have fallen on the floor. But the chances are pretty low that she would actually get sick from it.
Right. Exactly. All right. Sravia, I hope I'm saying your name correctly. Hi, and what is the worst cut? Generally, the deeper into your body a cut goes, the worse it is. Because one, you don't want to lose a lot of blood. Blood is good inside. You don't want to lose a lot of it. It's okay if you lose a little bit. Like I was describing before, you get a cut and it bleeds a little bit. That's okay. That's a natural part of the body that helps serve to get stuff out so you don't get an infection. If you lose too much blood, that's bad. All right, and we're going to cover a little bit later on really deep wounds that get deep in your body and why those are more dangerous. What if you had a cut and a dog licked it? That's a really good question, Milo. We're also going to get into that a little bit later, and animal bites and stuff like that. Anytime a mouth has touched a cut, that's not good. If you lick your own cut, I do not recommend that. If your dog licks your cut, dog mouths are actually cleaner than human mouths, but still not great. We're going to get in just a minute here the correct procedure for handling and cleaning a wound. I think we had another question up here from just a lot of people saying hello.
Yeah.
Okay, good. All right, it looks like a lot of the questions are exactly what we're going to talk about, so we're going to jump in here. Jump back to that screen. All right, here's the situation. A small wound or scratch with a little bit of bleeding. Okay, we have not decided on a name for this bear. We were discussing this intensely before the webinar started. I think we went with Benjamin. Okay, this is Benjamin. All right, let's say that Benjamin has, all right, can you see that well? Yeah. A small wound. Let's say Benjamin got a scratch on his left hand there, and there's a little bit of bleeding. Now it says, note, be careful not to get another person's blood on your own hands because you can get a disease more easily that way. If available, there are disposable gloves.
Uh-oh.
We have disposable gloves here.
And plenty of them.
Plenty of them. If you happen to have these at home, we're going to practice putting these on and taking these off properly. And it's a really good thing to practice because now my hands are not going to come in contact with direct, there you go, Remy.
Thanks.
With direct contact with this person. Let's say Benjamin's hand was bleeding. My hand is now not touching that blood directly, which is really good. If gloves are not available, place some other barrier between the blood and your hands. A clean plastic bag might work well. You should always wash your own hands well after you give first aid to someone who is bleeding, even if you wear gloves. That is true. Okay, So first aid with Benjamin here with this small scratch that is bleeding. Wash the wound with soap and water, let the skin dry, and apply a bandage. Okay, so let's say we have a sink here. We're gonna turn it on with warm water. You don't want it to be hot and really uncomfortable, but warm is good. And we're gonna wash with soap and water. Yep. And then we're gonna dry it off with this invisible towel. And we're going to apply the Band-Aid. I think we can put it right there. We apply the Band-Aid onto Benjamin's little wound. I think that we have all experienced this. This is a natural part of life and growing up. You get bumps and scrapes and scratches, and that's okay, as long as you treat them correctly. All right, he's good to go off and enjoy the rest of his day. It says here, if you do not have a bandage or the wound is small, you might leave it uncovered. I think we've all done that as well. You get a paper cut. I'm not going to necessarily put a Band-Aid on a paper cut or on a little scrape or something that I get. I bumped my knuckle last week and a little bit of blood. I just cleaned it and I left it. It was okay. You can use antibiotic ointment if you have some available. Like we said before, antibiotic is there to kill the germs. I did not put antibiotic ointment on this scrape that I got. If it was a bigger scrape, I probably would have. Okay. The next situation, a wound or cut where the bleeding does not stop right away. This is good. No, that's bad, but it's good to talk
Good to know
about
what to do, yeah.
Yeah, exactly. All right, put on disposable gloves.
Okay.
Or something else to cover your hands. Hello, Benjamin. Oh, gosh, that cut on your arm. Here, we're going to take off the Band-Aid, the Band-Aid there. There we go. Benjamin, it looks like you got a pretty good cut on that arm there. Oh, boy. Okay. Cover the wound with a sterile bandage or a clean pad or cloth if a bandage isn't available. All right. We've probably all seen a movie where someone comes running up and they like tear their shirt sleeve off and they like shove it onto the wound. That shirt sleeve is not sterile. It is not clean. You know, if there's a lot of blood coming out, I am way more concerned with that blood coming out than I am with possibly infecting them. It's more important to stop the bleeding if it's a lot. You can handle the infection when they get to the hospital. They can give them medicine that can prevent or stop that infection. So I have sterile bandage here. We're going to put that sterile bandage onto the cut, and it says, cover the wound, have the person press hard enough to stop the blood flow, or if you can't do it yourself. So, all right, Benjamin, I want you to take your hand, I want you to press really hard on that. Yep, I know it hurts a little bit, but press hard. Good, yes, okay, keep pressing there. If Benjamin's having a hard time pressing hard, I will do that. But it's better to have them do it. They can feel it, you can't. And as little as you can expose yourself to their blood, the better. Even though I'm wearing gloves and being good. All right, now it doesn't say it here, but let's say it keeps bleeding, it kind of bleeds through that bandage. I am now going to take more bandage, I'm going to put it on top. I'm not going to take the old one off. I'm going to leave it on there. I'm just going to put more on and more on. Okay, it looks like that's starting to come under control. It's not bleeding through that last bit of bandage. At this point, you definitely should have been calling for an adult, have someone to come and assist you. But for the purpose of this demonstration, let's say you were out hiking, there's no one else around for 1,000,000 miles. Okay, good. All right. Have the injured person press hard enough to stop the blood flow if you can't do it yourself. If the wound is on an arm or a leg and the bleeding doesn't stop quickly, raise the limb above the level of the heart. This will help the bleeding stop faster. All right, good job, Benjamin. Yep, reach that up there. Your heart is pushing blood into the rest of your body. If you're pushing a rock on a hill, it's easier to push it downhill than it is to push it uphill. Same with your heart and blood, even though it's not a rock. So by having something above your heart, it's a little bit more difficult for your heart to get the blood up there, and so it's going to make that blood flow lessen. Okay, after the bleeding has stopped, apply a sterile bandage. Okay, good job, Benjamin. All right, we're going to take this off. We're going to put a clean bandage on there. Now, if you have like a roll. Here, why don't you hold that there, Remy? Thank you very much. We want to hold this sterile bandage on the site of the wound. You might have a roll of what's called gauze. That's this, I'll get a little bit closer here. That's this stuff here. This is great. It's stretchy, it's absorbent. You can take this and you've probably seen this in movies and stuff like that. You can wrap it around the wound in order to wrap it around the arm to keep the bandage on the wound. It's really good. Another thing, I love this product. We'll assume that there's that on there. I'm seeing this in a lot of doctors' offices now. It's called Coban, and it's usually really brightly colored. It sticks to itself. You can use it to wrap around. It just tears right off, sticks to itself. There we go.
And Benjamin's gonna be good as new in just no time at all.
All right, how do you feel, Benjamin? Is that too tight? Is it cutting off blood flow to your hand? Is your hand getting tingly at all? No? Okay, good. If you apply that and you kind of bandage it up and it's too tight, it's cutting off blood flow and their fingers start getting tingly, you want to loosen that bandage a bit because that's getting a little bit too tight. Okay, afterwards, wash your own hands well with hot water and soap.
But wait, I still have blood on these gloves.
I have blood on these gloves too. Here's how you take off gloves. Again, the point is to keep the blood and other things that could infect you away from your own body, not touching your own body. On one glove, I'm gonna pinch the outside of the glove here, and I'm gonna kind of like bring my fingers together. I'm gonna use this to pull the glove over like that. There we go. The glove is now inside out. Any blood, dirt, stuff like that is now stuck inside of that glove. My hand didn't get it. With this hand, I'm gonna ball this up and hold on to it. I'm gonna take a few fingers and put it under, I hope it's close enough here, put it under the inside of the glove. Again, no part of my skin is touching the outside of that glove, and pull it over like that. Everything is now stuck inside there. You can throw this out in the trash can. Now that my gloves are off, I'm gonna wash my hands with soap and water very thoroughly. I think that we've all learned a lot about hand washing in the last couple of weeks.
I agree.
I'm gonna wash my hands for 20 seconds, very thoroughly, dry them off. Soap and water. Excellent. If it's a larger wound, have the injured person get immediate medical attention. Yes, if you're not sure if it's serious, treat it like it is. If you're like, I'm not sure if we really need to tell your mom about this, Remy. Okay, let's definitely tell your mom, right? Okay, good.
I think we should check. I think I saw some questions pop up.
All right, let's jump into, all of that was happening while we were looking at the thing, so you couldn't see.
I hope you guys could switch the screen and we didn't mess that up for you.
That would have been us. Sorry, everyone. That whole demonstration was on a small screen. We will make sure that we do that better on the next demonstrations. Yes. Okay, let's catch up to some of these here. What is the most blood you could lose before it gets really serious? There's a lot of blood in the human body. I forget how many gallons. I can't say exactly how to answer that question. What I can say is, if it concerns you, get medical attention. Yes. All right. All right, there's a lot of really good questions here that we don't have time to get into all of them, so I'm just gonna address a few specific ones. All right, does it matter whether you use hot, warm, or cold water?
Yes, it does.
Go for it.
Absolutely. You should use the warmest water that you can, not hot to where you're burning, but the warm water helps interact with the soap to get more germs and more bacteria off your hands, and it does a better job than the cold water does. So if you can get warm water, then use warm water.
Good. Ariana asks, how do you treat burns? Excellent question. That's coming up in a little bit. Stay with us. Okay. Wow, there's so much in here. I'm really sorry that we can't get to all of these guys. Have you ever got a very deep wound? That did happen to me one time. And I went to the doctor. They gave me some medicine that just in case there was something inside the deep wound, that I wouldn't get an infection from it. I was pretty worried about that, and it ended up being totally fine. I had gotten punctured like a stick stuck into my arm. So I went to my mom. You know, she helped with first aid stuff like we just saw. We went to the doctor, got some medicine. It was totally fine. Yep.
Amelie, you did not have to memorize this. We're just hoping to give you some more familiarity with it so that if you end up in one of these situations, you would have an idea of what to do.
Okay, good. Okay, Brittany, I think I understand your question here of like what happens if you get a cut on your head. A cut on your head is pretty much the same procedure for a cut on your, like on your elbow or your finger or your knee or something like that. One thing to know about head wounds is they do bleed a lot. That's not unusual. That's very normal because your heart's pumping very hard to get the blood up into the head. Same procedure. You're going to clean it. You're going to put the bandage on it. Keep pressure on it until the bleeding stops. Okay.
Cool.
Now, we have been going along on our learning guide here, which again, a link to this will be on the email that you or your parents received when you signed up for this webinar. And it said, on another student, do the first aid steps for a small wound or scratch, and do so for what happens if you have a bigger wound or cut that doesn't stop bleeding right away. We did that on our trusty Benjamin right here. Good. Next up is nosebleed. I think we have all had nosebleeds.
Definitely.
If you haven't, very good. Here's what you do. If you do have a situation, a nosebleed. A nosebleed is a small wound inside the nose. Because the bleeding comes from inside the nose, nosebleeds are handled differently than other wounds. Have the person sit up, lean forward, and pinch the soft part of his nostrils together for 5 to 10 minutes. You can also hold a wet cloth to his nose and face while he is pinching. He should not blow his nose for several hours after the bleeding stops. Afterwards, wash your hands with hot water and soap. Good. I'm going to get away from the screen share, back to the big thing. Okay, you lean forward, and because whatever wound is happening that's causing that bleeding, it's on the inside of your nose. So you're going to pinch that soft part right there. You see, my nose is hard, hard, hard. It starts to get soft. I'll pinch right there. All right. I can't really breathe very well. That's okay. It stops the air. It also stops that blood. One of my friends, when I was growing up, told me, yeah, you got to lean your head back. Go ahead, lean your head back.
I was told the same thing as a kid. Yeah.
I saw this in movies. I saw this in TV shows. We probably all did. Some movies and TV shows have great medical advice. Some have bad medical advice. That was one thing that I picked up from shows and from my friends. That was wrong. If you tilt your head back, any bleeding that you're going to have, the blood is now draining back down into your throat, and it's going to go down into your stomach.
That's no good.
It's not good. If you get a little bit, totally fine. Your stomach can handle that. But if there's a lot of blood coming from your nose, it's not great to have all that in your stomach. If you lean forward, it's going to drain out this way, and it'll help close that wound up faster. And then, of course, at the very end, you always wash your hands with soap and water.
And warm water.
Warm water, yes. If you don't have warm water, cold water is way better than leaving it on your skin.
Yes.
Good. All right. Next, we're going to talk about puncture wounds and dirty wounds. All right, let's get into that. Let's just check the Q&A box really quick and catch up on all this great stuff that you guys. All right, Gayatri, you asked what happens if you hit your head and the blood comes. I think we answered that a few minutes ago. Treat it the same way. Clean it, put a bandage on it, put pressure on it. Can a nosebleed get infected? It's possible. It's possible. If you have regular nosebleeds or like it happened and it starts to get really painful inside there, definitely it doesn't hurt to go see the doctor and to have them look at it. If they're concerned about that, they can give you medicine that helps your body fight that infection. Okay, good. All right, our next bit is on puncture wounds and dirty wounds.
Okay.
A puncture is a hole made by a sharp object, like I had when the stick poked into me when I was younger. Puncture wounds are made by sharp objects such as pins, nails, splinters, stabs, bullets, and even teeth through animal or people bites. Puncture wounds are often difficult to clean. Germs may be carried into the wound by the sharp object that caused it and may grow more easily in the deeper wound. Puncture wounds are more dangerous than what we call open wounds because the skin tends to close over the wound. So if you get a cut and the skin is open, but if it punctures in, then the wound goes deep and the skin kind of closes up over it. So open wound, closed wound. This can trap germs inside where they can't be cleaned out and the wound doesn't heal well. There is a germ present in most soil that can enter the body through a puncture wound and cause a serious disease called tetanus. One thing that my friend told me growing up was you get tetanus from rusty nails.
Yeah, I heard that.
I heard this a lot. Yes, you can get tetanus from rusty nails, but not just rusty nails. It's in dirt. It's kind of all over the place. It's one of those things that your body is constantly fighting on your behalf. Thank you, body. Tetanus causes an extreme stiffness of some muscles, especially those that control the jaw. This means it is a good idea for a person to get shots to protect himself from tetanus germs. It is usually recommended that everyone get a tetanus prevention shot every 5 to 10 years. If a person gets a puncture wound and hasn't ever had a tetanus shot, or if it has been more than 5 years since his last shot, he should see his doctor right away. Okay, good. So let's look at the situation and the procedure. Situation, a puncture wound with little bleeding, for example, stepping on a nail or a large splinter. Ooh, nails, yep. All right, or a large splinter, good. Step 1, put on disposable gloves. We're gonna do this again so I can demonstrate again on a big screen how to take it off. I'm gonna read through this and then we're gonna expand the screen and show our work on Benjamin here. Poor Benjamin. Clean out the wound, clean out of the wound anything you see such as dirt, gravel, or other things. Then gently press around the wound to help it bleed. Getting any blood or pus out of the wound may help clean it. Wash the wound well with soap and water. Put on antibiotic ointment and a sterile bandage. Afterward, wash your own hands with hot water and soap. Let's see if there's anything else here. If the person has not had a recent tetanus shot, make sure he gets to a doctor. You should be extra alert for an infection in a puncture wound because it can spread quickly and make the person very ill. If a puncture wound gets infected, medical attention is needed right away. Okay. Hello, Benjamin. Oh, what? Oh, you back. All right, and we'll hold him up here. I see that you stepped on a nail, Benjamin. Gosh. Okay. Well, got my gloves on to keep myself, away from his blood. There is the wound. We are going to, let's say we're like at a sink here and there's warm water running and we've got soap here and we are cleaning that wound. I can see a little bit of dirt there from when he walked over to us saying, I stepped on a nail. So we're gonna, clean that dirt out of there. All right, that looks clean. I'll take my invisible towel here again, and I'm gonna pat it dry. It doesn't say this in here, but I learned the hard way. It's better to pat it dry rather than like rubbing it. My brother did that to me once and it hurt. And then he patted and it hurt less. So that's good. Okay, and then we're going to take a sterile bandage and we are gonna put that on there. All right, Benjamin, if you can hold that there for me. Good, I can still see it bleeding a little bit there. Let's give it a few minutes. A few minutes have passed. It appears that the bleeding has stopped. This is very good. Okay, good. We are going to wrap that up here with this gauze. I'm not doing an excellent job here. I'm doing a rough demonstration. Yes.
This is real on-the-ground field work. You work with what you got.
That's right. I didn't bring scissors. I wonder if this gauze is going to tear. It will not tear. So I'll take that off your hands there, Remy. Good. Note to self, bring scissors for gauze. Great. All right, so very similar basic procedure with a puncture wound as with an open surface wound. One step that I forgot to do right then was putting antibiotic cream on it. So we would put the cream, bloop, 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 bandage, wrap it up. All right, now, again, we've got some blood on our hands, or even not, even if there's not blood, if we were being very clean about it, we want to take these gloves off in a clean manner. I'm going to pinch right there on the outside and pull it over my hand, so all the glove is now inside out. With my other hand, I'm going to ball the glove up like this, put my fingers on the inside of the glove, and take it off. All the stuff is now inside those gloves. You can throw them away. All right. Let's see what questions we have here. I got a nail in my foot once. Milo, I've been there too. Yes.
Mm-hmm.
Okay. What happens if you get bloody noses a lot? That's a good question, Sophia. Sometimes that can happen because of a really dry environment. That I've known that to happen to people who are used to a more humid environment like Florida, and then they go to the desert and it really dries things out. If it's happening a lot, do see a doctor about it. They can tell you more about that. All right. Let's see, there's dirt in your nails unless you cut your nails. That is correct, Gayatri. My nails are pretty clean right now. I keep them trimmed close. And when I wash my hands, I have a little nail brush that you can use, brush to get dirt out from under your nails. That's correct. All right. What do you do if you have no disposable? Dawn, thank you. Yeah, if you don't have disposable gloves, you can use a trash bag, a clean trash bag, like a fresh trash bag, right from the box, not a bag that has been used.
Or a grocery bag.
A grocery bag, something like that. Any plastic bag or something like that, just to create a barrier between yourself and the person.
And if you do get someone else's blood or something on your hands, it's usually not a big deal because you're not the one that's cut, but you just wash them as soon as you can and wash them really, really well.
Yep. Okay, good. All right, someone asked a great question here. Jordan, you asked, what does CPR do? That's a really good question. We're not gonna cover that in this class, but CPR, for those of you who might not be familiar with it, is a procedure that you can do for someone who has gone unconscious and they're not breathing. There's very specific classes that you do to learn how to do that. If you're interested in that, I highly recommend it. I do a CPR class about every 2 years, and it makes me feel good to know that if I find someone in a medical emergency, if they have a cut, if they have something going on, I can jump in and I can help them. Disposable means that you can throw them away. Thank you, Gayatri. Disposable means you can dispose, you can throw away. These gloves that we've been using, they're meant to be used once and thrown away. It's very different from my phone. This is not disposable. I will not be throwing away this phone. I'm going to use it and use it and use it. Okay, good. All right, let's jump in. We're starting to run a little bit low on time, but I think we have enough time to cover the next section here. All right, covered all that. Good, good, good. Minor burns. Someone asked earlier about burns. Minor burns, insect stings, and animal bites are mostly treated the same way as minor wounds, but first aid for some of these may have additional steps. In minor burns and sunburns, the skin gets red. The first kind of burn is called a first degree. This kind of burn is called a first degree burn. Degree means the amount of burn or how bad it is. A first degree burn is the least serious kind of burn. If blisters form on the burn, it is more severe, and it is called a second degree burn. Let's see, I
some pictures of this.
Yeah, I pulled up some pictures here. All right, there we go. On the left side of the screen, you have a first degree burn. It's red, it's painful, it's not great, but it is the least severe kind of burn. On the right hand side of the screen, you can see kind of white blisters have started to form there. It can be concerning and it can be really painful, but the body is equipped to deal with stuff like this, and you can help yourself or someone encountering this kind of burn with the steps that we're about to go over. Okay. So, situation, a first or second degree burn. If blisters form on a very small burn, do not break them. Breaking a blister turns the burn into an open wound. It makes it easier for germs to get in. If a burn blister breaks, it is a good idea to put antibiotic ointment on the wound before you bandage it to prevent infection. If blisters form on a large burn, the person should be checked by a doctor. Okay. First aid, if the person has a minor burn, soak it in cold water right away. Keep it soaking for at least 5 minutes. Okay, Benjamin, oh, you burned your hand. You were cooking, making pancakes. Pancakes are delicious. I support your decisions. But I see that you burned your hand. All right, I don't see any blisters forming on it, which is good. It's a first-degree burn. I know it hurts a lot. Let's come over to the sink right here. I'm going to turn on cold water and put your hand under that cold water. Good. All right, does that feel a little bit better? Yes. Don't take your hand out yet. It's only been 10 seconds. Leave it in there for several minutes, at least 5 minutes in that nice cold water. Because it's not just the top layer of your skin that's burning. The heat is going into your skin, into your body, and the burning is happening down deep as well. The longer that you soak it in that cold water, the more that cold temperature can get into your body and get down to that burning part down below, and it can help prevent further damage down there. Okay, it's been a good 5-10 minutes. All right, we'll turn off the faucet here. Put that over there. Dry off the burn or blister. All right, again, very much on this one. You're definitely going to want to pat it to dry it off
very delicately
instead of rubbing it. All right, so we're going to pat that dry. I realize we're on the small screen again. We're going to read through this, and then we're going to demo it. Again, it's my first webinar. Thank you, everyone, for your patience. Dry off the burn or blister. Put antibiotic ointment on a popped blister. Cover the burn or blister with a sterile bandage. In case of a popped blister, carefully watch for infection. Excellent. So we had it underwater. We dried it off thoroughly by patting instead of by rubbing. Okay, good. I do see that a couple of blisters started to form here, Benjamin. And I see that one of them broke. So we're going to take some of this antibiotic cream, this ointment, and we're going to put it on there. Okay, good. Let us assume that I was correct in my procedure, and I put these gloves on before I started treating Benjamin.
I think he'll forgive you.
Thank you, Benjamin. And thank you, Remy, for forgiving me. Excellent. All right. I think we can all agree that I had these gloves on earlier. All right, so we've got that dried off there. We've put on the ointment. I'm now going to take the bandage, the sterile gauze here. We're going to put that on there. And again, if it's small and you can cover it with a Band-Aid, totally fine. Mm-hmm. Same stuff. This is just bigger. And we will put this on here. All this orange stuff does is it just helps keep the bandage on. That's all it's doing. Okay, Benjamin.
He's been a trooper.
Rough day. Once again, I'm going to take these gloves off. I'm going to pinch there and pull it up and over. I'm going to hold that glove in my still gloved hand without touching that side of the glove, get my fingers under. There we go. All right. That's all we have time for today. Let's take a quick look into the Q&A box, answer a few more questions, and then we'll be on our way here. All right. Someone mentioned a third-degree burn in the chat. Yes, there is such thing as a third-degree burn. We talked about first and second-degree burn here. Third degree is worse. We're not going to cover that. If the burn is worse than what we were talking about here, medical help right away. Call 911. Call an ambulance, get them to a doctor. Definitely. All right, a lot of questions in here about third-degree burns. So you guys know what you're talking about. All right. Emmett asks, can you also put tinfoil on the burn? Emmett, I'm not familiar with that. I don't know really how to answer that question. What I can say is that tinfoil will not be sterile. It won't be sterile like if you take a bandage from a fresh pack, or if you take like a Band-Aid out of the wrapper here. So I'm afraid that's all the answer I can give on that. I'm not familiar enough. Gaia 3, what if you get stung by a bee? The very next section is insect stings. I really hope that you're able to tune into our next webinar tomorrow, where we're going to be continuing on this course. It's the very next section that we're talking about. All right. Good.
Okay.
Oh, Olivia, yes. What if he still had the nail in his foot? This is no, it's a very good question.
It is, yeah.
All right. If it's a small thing, nail in the foot, take it out. You want to get you want to get the thing out of there. Clean the wound as we talked about. Clean it with soap and water, and get the antibiotic ointment onto it and get it bandaged. If it's a larger thing, if you have a big stick, I said that I got, like a stick in my arm. It was a twig. It wasn't very big. If it's a big thing and it's deep in there, before you do anything, get an adult, get some medical attention. If it's a really big thing, you've got a big branch in your arm, keep it there. Keep it exactly where it is. Don't pull it out and get an adult, and they can help you with the next thing. That is, I think it gets into that a little bit later on. But for a small puncture wound like a nail or a little twig or something like that, what we have discussed is a great way to go about cleaning and sealing off that wound. Okay, everyone, it looks like we're out of time for today. We went over a little bit. Thank you so much. I hope that you are all able to join us again tomorrow as we continue our adventure into basic first aid and emergencies.